Yes.
Good evening, good afternoon, and good morning. This is the 2008th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. BIBHU Prasad Panda. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic lover or doctor or student, it doesn't matter. The purpose of this forum is to take homeopathy to every home around the world. And more than 75 countries has participated in our sessions so far. Doctors and eminent personalities from different fields has presented various papers, and all the papers were brilliant. And we are very happy to say that more than 3,500 videos were uploaded in YouTube. Those who want to see our previous videos, you can just click on IFPH Homeopathy at YouTube. So you can watch all the previous day sessions also. And let me come to today's guest. As you all know, it is none other than Professor Dr. BIBHU Prasad Panda, who has completed MD Homeopathy and is a professor and campus director, Rajkot Homeopathic Medical College, Rajkot, since 2025, and was a former principal and hospital superintendent, Paul Institute of Homeopathy and Research Hospital, Vadodara. And Sir has more than 33 years of teaching experience and has presented various papers in national level, state level, and international level. And he has presented a paper during the legal session in Delhi. And is one of the most wanted faculty in all part of the world. And Sir has presented several sessions in this forum. All these presentations were exemplary, brilliant one, and we are very happy to say that a different subject is to be discussed today. That's a very, very interesting one also, and that is disease label versus patient portrait, the homeopathic perspective. So we all know that people used to say that once you diagnose the case, you can prescribe the medicine in the quickest possible way, but it is not like that in homeopathy. Homeopathy, it is an entirely different system where you have to individualize each and every person. So what is the relevance of the disease name and what is the basic difference in patient? That may be the thing that Sir is about to explain today. We proudly welcome Professor BIBHU Prasad Panda. Welcome, sir.
Thank you, sir. I'm very much happy and feel proud that the session of 2008 is going on. So it is not a joke. It is very tiresome and regularly it is delivering. Today, the cricket match is also going on. Several events are going on. Still then, we are continuing the session for the fraternity. So definitely it is appreciated. So today, I want to present my presentation about the homeopathic perspective, disease level and disease patient portrait. So let us share my slides.
Okay.
Sir, it is visible?
Yes, it's coming out. Yes, now it is visible. You can go.
Yes, sir.
Thank you, sir.
So thank you, Dr. Dhanesh. So let us first analyze the topic, that is disease level and patient portrait, the homeopathic perspective. So what is homeopathic perspective? let us come to the word perspective. Dr. Hahnemann has written in aphorism number 3 that the physician has to perceive what is to be cured in the disease. So whether what we are seeing that should be considered or what we are not seeing, that means the cause, the behind proximate cause, that should be considered. So it has been clearly written in aphorism number 3. So perspective means having keen insight or understanding. So in this topic, with some examples and case presentation, we have to discuss that what is the keen insight about the disease level and patient portrait. On homeopathic perspective means whether homeopathic perspective means perspective of individualization, dynamic concept, and similar what is our law. So in dynamic concept, then your uh, individualization as well as whether it is correlating with the law of similia or not. That should be our discussing matter today. Next, disease level and patient portrait. This presentation, what I told, explores the contrasting approaches of disease labeling and patient portraits in homeopathy, emphasizing the importance of holistic perspective in understanding patient health beyond mere symptomatology. So, the differentiate point, if we will discuss the philosophy in philosophy, toward close philosophy, what he has written in the topics of schools of philosophy. So there are three schools of philosophy are there: idealism, spiritualism, and materialism. So the conventional medicine, they believe in materialism, that means matter and motion. So the things to which we can able to see, the things which we can able to touch, that is present. They don't believe in mythology. They don't believe in our what I'm telling, that is dynamic concept or holistic concept. As our stalwarts, Richard Hughes and Carol Donham, they are practicing following this type of concept. They don't believe after the fourth aphorism. Of course, they are the believer of homeopathy. They are strong followers of Hahnemann, but they are always practicing lower potency where the material quantity present inside the medicine. So after fourth edition in 1833, the fifth edition was published. In that fifth edition, the drug dynamization has been introduced. So we are treating the patient on dynamic concept. In homeopathy, there are three dynamics are there. One is vital dynamics, which is governing the material body within us. Another is the drug dynamics or medicinal dynamics, which is present inside the medicine. The third was the disease dynamics, which is present inside the disease agent. So all are dynamics and their force are dynamic in nature. So one dynamic can affect another dynamic if it is stronger only. So that is the concept of homeopathy. So in this prospect, we have to discuss that whether we have to follow the disease level or we have to follow the patient portrait or we have to do integrated approach. Now, in national education policy also, our government has introduced the CBTC pattern of teaching in UG and PG level. Curriculum based dynamic CBDC's curriculum based dynamic curriculum, competency based dynamic curriculum. So that competency based dynamic curriculum is nothing, that is integrated approach of teaching. So we have to touch the our students in three level. That means one dynamic, one is that is horizontal way, then vertical way, then spiral way. So these are the three type of teaching we are delivering as per the CBDC competency based dynamic curriculum. So horizontal teaching means we have to correlate the subject of the same class and in integrated approach. For example, uh, anatomy knowledge gives us the idea if about the symptom, in support of that symptom which is present in belladonna, that is pain in right ileocecal position. Whenever there will be pain in right ileocecal position, that is a symptom. A student can able to understand the symptom clearly if he has having the knowledge of anatomy. In right ileocecal position, our appendix is present. So if there will be pain in right ileocecal position, that is because of appendicitis, so he can correlate the pathology, the anatomy with the mathematica, with pathology, with practice of medicine, like this. So this is called, or this teaching is called horizontal teaching. Anatomy correlated with mathematica, correlated with physiology, correlated with pharmacy. And vertical teaching means we have to correlate the subject of first BHMS, second BHMS, third BHMS, and fourth BHMS as an integrated approach. The knowledge of anatomy you will get from first BHMS, the knowledge of pathology will get from second BHMS, the knowledge of surgery, gynecology, obstetrics we will get from third BHMS, and the medicine, community medicine, this knowledge you will get from fourth BHMS. When you teach the student or you read the subject, any topic in vertical manner, that is called vertical teaching. What about spiral teaching? Spiral teaching means when we study or we read a particular topic in deeply, that means internally. For example, vital force, that is a real force, and that vital force was changed to vital principle in sixth edition of Organon because the disciple of Hahnemann demanded that vital force is a force like other forces which must have a source. So to clear this confusion, Hahnemann replaced vital force into vital principle. So vital force is a force of dynamics, that vital principle. It has having some limitation. So this study that what is the source of vital force in in related to relation to vital force, if you go to ICR books, then it has been clear written that the vital when the zygote is formed, concerning the ovum and sperm, the vital force or the vital principle, they entered from the cosmic vital force to the zygote, or cosmic vital principle to the inside the zygote as vital principle. So in this way, the vital principle get entry. After entry, then what happens there? The vital force, the vital dynamics, the simple substance, what Kent has mentioned, it operates centrifugally. Centrifugally means the vital force is supplied in form of influx to different groups of cells during cell division to solve a particular purpose in future. That means brain, kidney, lungs, heart, then liver, these are organs. So as per the energy which is needed for those organs, the vital force is supplied by the vital principle to those group of cells for to solve a particular purpose in future. Likewise, if the force which is supplied to different groups of cells to solve a particular purpose, if the energy is less than that, then hereditary dyscrasia, underdeveloped organ occurs. If it will be more, then that particular organ becomes hypersensitive. That is that may be that organ may be cause your idiosyncrasy, which has been mentioned in 117 aphorism. So these are different study which can be included under your spiral study. So considering the homeopathic perspective, we have to discuss disease level and patient portrait in different manner with example. Then next, this is a table I have framed out. I have taken to differentiate between the disease level and patient portrait. So the features that we have to focus in the disease level, the common pathology generally. So we are considering the pathology, and on the basis of that pathology, we diagnose the disease. So diagnosis is differentiation of one disease or identification of one disease by considering three things: clinical examination, number two, pathological investigation, number three, the imaging. So these are the three parameters, three guidelines by which we can able to diagnose the disease. That the disease is psoriasis, the disease is malaria parasite is found, the disease is tuberculosis. So clinical examination, number two, pathological investigation, number three, imaging. So these are the things which guide us to diagnose the disease, and as disease is diagnosed, accordingly the treatment is done. Whereas in patient portrait, the word has been used by Hahnemann in aphorism number 6. So in aphorism number 6, Dr. Hahnemann has written that a patient portrait is framed out taking the subjective symptoms expressed by the patient, the objective symptoms collected by the physician himself, the objective symptom expressed by the attendants and relatives. So all the symptoms they have to collected during case taking, following the general direction and special direction of case taking written by Hahnemann, and those symptoms they have to organizedly placed, they have to arrange in such a manner by which a portrait is formed. That portrait is called patient portrait, and that patient portrait has to be compared with a medicinal portrait. The medicinal portrait or the medicinal totality, which is very similar in all respect with the patient totality, that means the patient portrait, that is the simillimum that should be administered. So patient portrait, why the word portrait was used by Hahnemann? Because it is unadulterated. During case taking, whatever symptom we have to take, that symptoms must be taken cleanly. There should not be any adulterated. Whenever you draw a portrait, there is no background, photography. But when you take a photograph, then the background picture comes, so you may confuse. So Dr. Hahnemann has advised that we have to take the precise symptom which are needed to select a simillimum. In homeopathy, the case taking format, the case taking which is conducted in that case taking format, haphazard symptoms are present. So after case taking, we have to perceive. Case receiving is another feature, then case perceiving. So you have to perceive the case and the symptoms and signs which are needed to frame out the portrait. We have to consider those symptoms and signs, and we have to organically place all the symptoms and signs in such a manner by which the picture of the patient is constructed, and accordingly we have to give the medicine. So that's why we frame out the patient, because our selection of medicine is individual medicine for an individual patient. So not like the disease level. So for in disease level, they prescribe the same medicine to all the persons diagnosed by a disease. For example, paracetamol is prescribed all the persons those who are suffering from fever to subside the fever. But we are selecting the medicine not like that. So though 4 persons they are suffering from different types of diseases, but the same diseases, we have to prescribe different medicine for different patient, though they are suffering from fever. One need brownia if he thirsty, one need gelsimum if he thirstless, and dull disease drowsiness is there. So this is the basic difference of disease level and patient level. Then in respect of prescription, so in disease level, the prescription completely depends on the nosological name. For example, we are giving anti-malarial drug like chloroquine in case of malaria on the basis of diagnosis, not by nosological names. For typhoid, chloramphenicol, like this we are prescribing. But here in patient portrait level, this type of specific medicine is not prescribed, we have to consider the patient as a whole. In holistic point of view, the medicine which comes, we consider the psychological factor, we consider the mental symptom, physical symptom, all the symptoms. And after collecting all the symptoms, the portrait which is formed, that medicine need to be prescribed in that case. So though a person is suffering from diarrhea, in one case we have to give pulsatilla, in another case we have to give yellow because the signs and symptoms which are collected, after organize them in a systematic level, in a particular principle, the picture, if it is like pulsatilla, we have to give pulsatilla because the patient is timid, yielding disposition, beautiful girl, but unweeping disposition. These are the mental symptoms, and the physical, though the physical symptoms are diarrhea causing by taking fat food, oily food. So these things must be considered in homeopathy. In but allopathy, they do not consider. If the finding is or the Widal test is positive, they prescribe the anti-typhoid drugs. Then nature. In nature, if you consider the disease level, they're static and generalized. So the generalized means in every case of typhoid fever, continuing fever is there, Widal test is positive, then pair patches are found. There may, in late case, there may be melina. So these are the features we'll get in disease level, and we prescribe accordingly. But in patient portrait level, we have to approach holistic point of view and individualistic point of view. No two individuals are alike. No, five fingers are not equal. So though five fingers are not equal, so 5% they don't their medicine cannot be same. So in this respect, we also contrast. We also defend our system from conventional medicine. So holistic. Why we consider holistic level? Because the material body is consisting of the three things, that is mind, body, and soul. These are the trinity of life. So when there will be equilibrium between the trinity of life, then the health, the person is considered as health. So all the parts, organs, they unite each other. All the system, they unite each other. They function as a unity, and the output is health. So if they act as a unity in healthy condition, how can they act in different manner? How can they act in different manner in disease condition? Also in disease condition, though one part, one organ, one system is affecting by the disease, but all the other parts, they will compensate. If a person is suffering from colic, then automatically she or he cannot be stable in mind, and he cannot perform his duty. That's why the patient must be considered as a whole. Whenever we are treating, we have to consider the psychological factor, we have to consider the mental disposition in physical disease, and in mental disease, physical condition must be considered. For example, a person who is suffering from throbbing headache, the headache is ameliorated by wrapping the head. The pain comes suddenly, goes suddenly, and that is having a pet carotid. So if you consider these symptoms, but naturally the belladonna, the medicine comes to our mind. But if those things which are we seeing externally is because of failure in examination, because of the grief or death of a nearest person, then Ignatia will be the medicine, not belladonna. So this holistic concept, these things we have to consider. Just we look the medicine, that is chamomilla. In chamomilla, the diarrhea of the child occurs because of the indignation of the mother. So that diarrhea, that is physical, which we are seeing externally, but if the diarrhea is because of the indignation of the mother, anger of the mother, then your medicine, if you prescribe on the basis of the nature of the stool or type of stool or frequency of stool will fail. We have to consider that the diarrhea occurs because of the anger of the mother, because of the indignation of the mother. Accordingly, we have to prescribe the medicine. Then the goal in disease level and the goal of patient level are clearly different. The goal in disease level, that is treating the disease entity. If there will be inflammation, that means synovitis is there, the conventional system, they consider that the knee is suffer, the disease is restricted to knee. Accordingly, they give anti-inflammatory medicines to reduce the inflammation, to reduce the pain. But in our system, it's completely different. We have to consider the cause of inflammation, and we have to take the totality of the symptom. Accordingly, we have to prescribe the medicine to by finding out the cause. As it is said that in homeopathy, we consider the process, not the product. The product is inflammation of knee. In homeopathy, we consider the cause, not the effect. In homeopathy, we consider the beginning, not the end. So our aim and objective to find out the cause, to find out the process, to find out the beginning, to find out the world of thought. Because whenever we are telling something else, express something else, that express it because of your thought. So if the thought is good, then definitely the outcome will be good. So if we restrict the thought and modify the thought in healthy condition, then there will be no situation will occur. The person will behave, the behavior of the person will be accordingly. So there is a basic difference of treating also. They consider that the part, the organ which is disease, the disease is restricted to that part. But in our system, in homeopathy, we consider the patient as a portrait of the patient, and we consider the person as a whole as per the holistic point of view, as per the totality of symptoms. We have to prescribe the medicine. As it is said, the principle of totality of symptom, the totality of symptom based on the principle conception and perception. Conception without perception is blind, and perception without conception is empty. So a person, a physician who is well aware and having the perception to identify that what is to be taken in from the patient to select the medicine, and if he knows that how to implement his perception in conception, then he will be success. So to favor the totality, he should have thorough knowledge about perception, and how to apply the perception in field of treatment. He should have the concept. Then only he will be able to establish ideal of cure. So now let us understand the disease level as per homeopathic perspective. So disease level, in here I have drawn a schematic diagram. When the susceptibility becomes low, when the person becomes susceptible towards any anemic agent, get exposure, then what happens there? The first there will be subclinical disease, pathological changes starts. So during pathological changes, you may not get the sign symptom, then sign symptom comes, and diagnosis is based on signs and symptoms and investigation report and imaging, and accordingly we have to give the medicine. This is the disease cycle. So we need to understand that what is the positive side and negative side in disease level. So disease labeling involves identity and classifying health condition based on symptoms and medical criteria, leading to standardized diagnosis that may overlook individual patient experience. So a patient who is suffering from fibroid of uterus. So in disease level, only the fibroid of uterus is considered, and accordingly the treatment is given. But this is quite different from our patient portrait. We are not considering the fibroid. So fibroid of uterus, that is the external manifestation, external effect of internal disease condition. the miasm that is predominant miasm is psychotic. So you have to consider the miasm, and accordingly if you prescribe antipsychotic medicine, then it will be radically cured. In the previous session, in thyroidinum, madam has clearly explained that she has given so many cases where you fail to cure a disease and there is history of thyroid hypothyroidism in family, then the well indicated medicine fails to cure, and if you prescribe thyroidinum, even the corn which appear in the soul of the person was cured completely by prescribing thyroidinum 200. That is the benefit of portrait level. But if you treat only the corn by external application, by removing the corn, then the corn will again appear. So it is not the way of treating. If you treat like this is like removal of branches of the tree where the root is there. We are cutting the branches, but root is there. If the root is there, then again the branches comes. So cutting the tree, cutting the branches is your disease level, and root out the tree from the root as well as the branches, that is your portrait level. So the impact, what will be the impact if you treat the case considering the part only? It may lead to palliation, and the palliation may lead to suppression. So if you suppress, then it will affect the deeper organs. The disease will go from curable to incurable stage. So incurable stage, as we know that one miasm invites another miasm. Sora is the mother of all chronic miasm. If will not give proper anti-miasmatic medicine, then the functional level, the disease which was present in functional level will proceed to structural level. Then psychotic miasm get entry, then syphilitic miasm get, tubercular miasm get entry. So likewise death occurs. But if we'll consider the root with the branches, then the medicine which is selected, that is the simillimum, and it will remove the cause. When the cause is removed, the beginning is removed, the process is removed, automatically the effect is removed. So that is the benefit. So what will be the impact of treatment in diagnosis? This approach often directs treatment plans that focus on achieving symptoms rather than understanding the patient overall health. So overall health is not considered, only the part which is affected, that is considered, and that is treated. If a person is suffering from insomnia, so they prescribe sedative to bring tranquilizer to bring sleep. But when the effect of the tranquilizer is over, then again the person will suffer from insomnia. If that tranquilizer will be continue for a longer period, then it will lead to artificial chronic disease, which is most deplorable, most incurable, written by Hahnemann in between 74 to 76 aphorism. So if the treatment is done on the basis of disease level, it will cause palliation, and palliation cause suppression, and suppression is most dangerous, and the curable cases becomes incurable. What is the challenge of homeopathy in understanding the disease level? Homeopathy challenges conventional labeling by emphasizing individual symptoms, emotional state, and unique health histories in treatment, providing more tailored therapeutic approach. So our challenge is to establish our view, our scientific approach in the tracing of the symptom in case taking, and make it individual. And after individualization, a individual medicine need to be prescribed. So this is the challenge to present that should be present before the conventional medicine, by which the conventional medicine, yes, whatever way they are treating, that should be considered, and our system will be more scientific in which will be accepted by the fraternity of health science. Then importance of patient portrait. If you form the portrait, That means we consider subjective, objective symptoms both. Then definitely the radical cure in curable cases must be established. The question will arise whether we need the knowledge of diagnosis. Yes, definitely. So the knowledge of diagnosis will support us to manage, to refer, to manage the complications and prognosis. The knowledge of prognosis, these things we acquire from the knowledge of diagnosis. So diagnosis knowledge is essential as a support. But as per medicine is concerned, the simillimum concern, we need to remember that our policy, we have to collect uncommon peculiar symptom, characteristic symptom which are needed to select the simillimum. I am giving example. For diagnosis, we require the common symptom polyuria, polyphagia, and polydipsia. So these are three symptoms which are needed to identify the disease, that is diabetes. So diabetes can be identified, but we can't select the simillimum because these symptoms are not uncommon peculiar symptoms. These are the pathognomonic symptoms. They are the symptoms of the disease. We require the pathogenetic symptoms. So if we don't collect the pathogenetic symptom, collecting the characteristic symptom described by Hahnemann in 153 aphorism, then we can't able to select our simillimum. How the simillimum can be selected? If we take the uncommon peculiar symptom, for example, weeping disposition, of fear of opposite sex, ameliorated by open air, thirstlessness. You can select the medicine, that is pulsatilla, whatever may be the disease. Disease may be rheumatism, disease may be diarrhea, disease may be asthma, whatever it may be. But if these symptoms, that is weeping disposition, then open air ameliorate the complaint, consolation ameliorate the complaint, then changeable mood. So these are the symptoms. If you collect, it helps us to find out the medicine pulsatilla. Even in pulsatilla, it has been written that if the patient is not since puberty, then the medicine is pulsatilla, irrespective of hormonal changes, irrespective of any type of diseases. If any problem arises just after puberty, the medicine is pulsatilla. That is the pathogenetic symptom of pulsatilla. This knowledge we require. So what is the importance of portrait? So we need to frame out the portrait. We should consider the bacteria, viruses as materia peccans, material cause of the disease. We have to take the support of diagnosis to manage, dietary manage, and dietary manage as well as auxiliary measures. Dietary manage, for example, a person who is suffering from any type, suffering from diabetes, you have to restrict sugar. So that is help. Though our medicine may be arsenic, maybe cesium, whatever it may be seen, but we have to restrict the sugar, or the sugar may play a role of obstacle in the path of cure. Therefore, we have to take the help of diagnosis. We have to refer the case if it is we are having limitation. If it is artificial chronic disease, we have a limitation. So where the disease appears not because of nature, we have a limitation. We have to refer the case. In case of poisoning, in case of any type of accident, we have to refer the case. So knowledge of disease, knowledge of diagnosis is required as a support, but to select the simillimum, the portrait of the patient, the knowledge is the portrait, how to form the portrait should be there. Then only the radical cure we can establish. So that portrait has been written in aphorism number 6. I have quoted here. So in aphorism 6, Dr. Hahnemann has written that the portrait has to frame out considering the subjective, objective symptoms of the patient, and when you consider all the symptoms of mind, from the symptoms of body, the symptoms of soul, so in a holistic point, the picture you will get, and on that basis, you have to select a medicine which which cover all the symptoms of the patient. That is the minimum, because in homeopathy there is no surrogate, though no replacement for a given medicine. Other medicine cannot be prescribed, and we have to follow our policy to get a better outcome, to establish radical cure, to avoid palliation, to avoid suppression. So homeopathic principle must be followed. Then only this is our perspective. So whatever may be the disease, yes, whatever may be the disease by name, we have to follow our principle. We have to consider the patient in dynamic way, that the dynamic vital force, the dynamics is deranged by morbific anemic agent, that is your miasms. So in chronic cases, so when the miasm entered, even now we are establishing scientifically about the germinal layer, means ectodermal, mesodermal, endodermal. Those diseases which affect the ectoderm, they are more susceptible towards sodic manifestation. Those organs which are developed from mesoderm, they are more susceptible to syphilitic miasm. Those who are developed from endoderm, they are more susceptible to suffer from your psychotic miasm. So this concept must be included to establish radical cure. We have to always stick to our principle, similia similibus curantur. The medicine which covers all the symptoms of patient in all respect, in pace, in intensity, that medicine will be similimum. When that similimum will prescribe in proper dose and potency and proper repetition is done, then only you can able to establish radical cure. And this is only possible if you consider the patient as a holistic view. We should not treat the part, we should not treat the organ, we should not treat mind, we should not treat body separately. We have to collect all the symptoms, and we have to arrange all the symptoms and signs in such a manner by which a perfect portrait will get. And for that portrait, we have to, or for that totality of patient, we have to find out a medicinal totality which covers almost all the symptoms of the patient, and we will cure it. Yes, in some cases, the difficulty we are facing. So that was mentioned by Hahnemann, between 172 to 182, that is one-sided disease. So where there is scarcity of symptoms, the patient will come, that he will explain that, sir, I am suffering from left-sided headache, and that left-sided headache is aggravated between 10 to 11 a.m. So there is no any other complaint. So that is few symptoms. On the basis of few symptoms, we have to prescribe medicine. Then that few symptoms helps us to explore the medicine. What I am telling, that is accessory symptoms of medicine. Those accessory symptoms of medicine and previous symptoms will be taken. Another medicine will be given. So in this way, we have to establish our cure. So of course, these are difficult, but it is not impossible. So this knowledge we should have with us. We have to consider our principle, that is dynamic principle, that is law of similia, that is holistic concept. Then only the cure will be established, and we have to stick to our principle to establish our science radically. Then let us consider an integrated approach between the disease level and patient level. Nowadays, the government, the health workers, WHO also insisting to treat the patient in an integrated approach. So now the WHO is emphasizing, but Hahnemann from the beginning, Hahnemann has written in the first aphorism, the physician's high and only mission is to restore the sick to health, to cure, as it is termed. Physicians, the only mission is to cure. So the cure must be established in which way, that has been described in second aphorism. That should be the highest ideal of cure is rapid, gentle, permanent. But in first aphorism, Hahnemann has emphasized to our aim and objective, being a physician, to cure the disease, nothing else. So we should not waste the time to investigate how disease occurs, in which way disease occurs. But afterwards, Hahnemann has written everything. But for treatment, if the patient is suffering, so our aim and objective to give relief to the patient and to establish radical cure. The cure must be permanent. The removal must be the removal or annihilation must be root as well as the cause. So the for this purpose we can take the help of other system by communicating with other system and other principle where the system is benefited, because every system has its own scope, every system has its own what are limitation. So where we have having limitation, we have to take the help of other system. For example, we have having limitation in case of true surgical diseases. So in those cases, we have to take the help of conventional medicine surgery. So a true surgical disease means fracture. So in case of fracture, we have to take the help of orthopedic surgeon. So immediately, yes, we can give the medicine symptom for quick healing of the fracture. We can give arnica for injury. So this medicine we can keep, but we have to take the help of surgeon because we have having a limitation. So every system, every doctors, every physician, they should well aware about their limitation. They should well aware about their scope. So we have having a great scope where the diseases are originate from nature. We have having a limitation where the diseases have not originated from nature. For example, we have no medicine for artificial chronic disease which is created by taking long continued taking of what I am telling purgatives. So if a person is suffering from constipation and after taking purgative, the Alcolax, Thiamchun, etc., he gets relief. But after some time, the dose has to be increased, the duration, the repetition has to be increased. A time will come, in spite of giving a purgative, the patient will not get relief. So in those cases, we can't help, because that disease, the constipation, that is called artificial chronic disease, which is not cured by homeopathy. Only we can manage the case. So we should know our limitation, we should know our scope, and when we need the help of other system, we without hesitation we have to accept it. For example, we are treating a case of what I am telling, that is blood pressure, having high blood pressure. In those cases, we may give her medicine on the basis of cause, but we have to advise the patient to take the diet that is salt restricted diet. Yes, that salt restricted diet, the dietary management, the knowledge we are getting from diagnosis from conventional medicine, we have to take the help of that. Right? In case of any type of injury, there are massaging, Ayurvedic massage is there. We may take the help of Panchakarma with our medicine. So that is called integrated approach to fulfill our mission, what has been written by Hahnemann in aphorism number 1. Then, so this is a picture graph that is indicated the integrated approach to establish health. So we have to take the help of conventional medicine in prognosis, in management, dietary, and auxiliary management. For example, a person is suffering from fever, we have to do cold sponging to reduce the fever, apart from our medicine, belladonna, arsenic, gelsemium, whatever it may be. So that is the knowledge we are getting from conventional medicine. Then self-care. Self-care, the patient self-care is one of the obstacles in the path of cure. If the patient is not aware, he is not ready to take care, he will not take medicine in proper time, he will not maintain the diet, then it is not possible to establish radical cure. So we have to approach in integrated manner. We have to take the help of conventional medicine where there is scope. We have to take we have to advise the patient to take self care during treatment. You should not take any other things which will affect the medicine, and our medicine should be given when this medicine is given. In curable cases, this help is taken. That means homeopathic medicine on the basis of portrait, conventional medicine, the auxiliary measures and dietary measures, self-care, proper taking of medicine, proper care for medicine, proper diet should be taken by the patient without taking any stress. Then the this combination will get, and the health will be restored in a short time. That should we followed. Then next, case studies and examples. So I am giving the two cases simple for as per examples. So a patient labeled with chronic asthma treated holistically in homeopathy showed significant improvement by addressing underlying emotional stress and lifestyle changes in addition to symptom management. If he is suffering from asthma, then we are having so many medicines. So what we are doing in acute exacerbation, in acute episodic attack, we are prescribing acute remedy, and when the acute exacerbation and is over, then we are following our chronic remedy. So this principle we need to follow in asthma. For example, because of exposure of dry north wind or cold wind, a person may get more intensify in heat suffering. So in those cases, you can give your Econite 3x. When the Econite 3x is given, the acute exacerbation of chronic complaint is over, then we have to go to our constitutional medicine or anti-diabetic medicine. So this can be done as a policy, and it is we are doing to get the result in our system. So second case, homeopathic practitioner assess a patient with a label autoimmune disorder by developing a detailed patient portrait, resulting in tailored remedies that signifying improve their quality of life. Yes, autoimmune disease like rheumatoid arthritis, ulcerative colitis. So in conventional medicine, they are having the routine drugs. No, there is no cure at all. So because they are the genetic disorders. So to cover the genetic disorders, we select our medicine and format portrait, because we are treating the patient, not the disease. So whatever may be the disease, if we are getting the uncommon peculiar symptoms or characteristic symptoms, and on the basis of that characteristic symptoms, if we prescribe medicine, so whatever may be the disease, even our medicine, it has been seen that the mutation of gene is occurs and the disease is cured. So every cases, chronic cases, natural disease cases, we need to frame out the portrait, and on the basis of that portrait, we have to prescribe medicine. If there will be any obstacle, that may be miasmatic, that may be constitutional, that may be hereditary. Accordingly, intercurrent remedy must be given to remove the blocks, and radical cure is established. This should be done in integrated approach, right? Then next, challenges and futures. What are our challenges in future? That we have to present our policy, our objectives, that we need to treat the portrait, we need to frame out the portrait, we have to treat the patient in holistic point of view, considering the soul, mind, body, not the part which is suffering. We should not consider the part in which disease symptom is present. This philosophy, this policy, this logic, we have to establish with evidence by which the conventional system should adapt it, and with an integrated approach, we should fulfill our mission. For example, in our system, we have to treat a case of malaria fever. So we are not treating the malaria. we were treating the patient. So considering the uncommon peculiar symptom of the patient, we prescribe a medicine Chinilum sulf. So when Chinilum sulf is prescribed, automatically if it covers the symptoms of the patient, then the fever will subside. So when the fever will subside, we should have the evidence that after 1 day, 2 day, 3 day, this is the position, the fever with symptom, the malaria parasite is not there in the blood. So that evidence must be with us, by which the conventional system of colleagues, they will understand it, they will accept our system, and if we all will treat a case with integrated manner, we can establish the cure, and that should be our aim and objective to deal with the patient. Thank you very much.
Thank you, Professor Dr. BIBHU Prasad Panda, sir. It's really a very good session, and you really show how important to integrate things together, because we all know that homeopathy is a part of this Irish system, and why the government has implemented these things together, we know that. But unfortunately, the so-called modern people are not cooperating with the ICE group. That's a biggest challenge, because they are the people supposed to treat in a different way. They are not allowing us to give our medicine along with the so-called modern system of medicine, where they have no medicine for the so-called viral diseases. But still, things are going in that way. But the government is not able to understand why these systems need to work together. That's the reason why some years back the union minister, I think Mr. Dr. Ambumani Maran was the health minister of the central government. He want to all doctors sit together in same hospital, whether it be in a allopathy hospital, a homeopathy hospital, or a Ayurvedic hospital, it doesn't matter. Then the patient can choose whether he want to take allopathic medicine, homeopathic medicine, or Ayurvedic medicine. But the so-called big people, they really spoil that chance for the patients to get such kind of treatment from all these systems. So that's the reason why a special group has formed, named the ICE group. But unfortunately, most of the fund from ICE group goes to the Ayurvedic system. Most of the eminent personalities from the ministry believe that ICE system means Ayurveda, but it is not. Homeopathy needs a special sanction to build a lot of work. Our funding also very much less. So we will have to work together to take homeopathy to high height, to new height. For that, we need funding as well as cooperation from all categories of people. This is what I would like to ask. I would like to say about that. I am inviting Dr. Harikumar. If you are there, you can say a vote of thanks as well as your comment on the presentation. So now I am inviting Dr. Sheila to say a vote of thanks. Dr. Sheila?
Hi, sir. Good evening, all. Can you hear me, sir?
Yes.
Yes, sir. Really, it is a wonderful section, sir. A great day with you. You already explained the importance of taking a proper case taking in order to select the simillimum accordingly. And also, the diagnosis is, even though diagnosis is important in all cases, but individualization is the most important thing to select a remedy. So it really a good session, sir. And actually, you explained all the aphorisms in the organon of medicine also, and for the integration of all the systems together in order to get the proper cure and comfort to a patient. Really a wonderful section, sir. Thank you so much. On behalf of IFPH, we really congratulate and appreciate your effort to explain all these things, and thank you very much on behalf of IFPH and from myself also, sir. So thanks a lot, sir. Thank you,
madam.
all
Thank
the
you.
audience also for this wonderful session, for those who are hearing this one, sir. Thank you.
Thank you,
Thank
madam.
you. Thank you, Dr. Sheila, Dr. Professor BIBHU Pandey, and those who attend the session. Tomorrow we will have a session from Dr. Kajal Verma, and she will be talking about hormonal imbalance, a lifetime-driven endocrine epidemic, and homeopathic insight. With that, we come to the end of the day 2009. Over to Dr. Maria Majum to moderate the Malayalam session. Thank you all. Good night.